Hi, I'm Nancy Murray, and I'm going to talk today about auditory processing treatment. I am an audiologist and a speech-language pathologist who specializes in auditory processing disorder evaluation as well as treatment. Previously, I've talked about auditory processing disorder strategies as well as the evaluation of auditory processing disorders. Those videos can be found on the Utah Neuro Rehabilitation YouTube channel. Today, we're going to talk about treating auditory processing disorders. Just like in the evaluation, treatment requires a team. You are part of that team. Whether you have an auditory processing disorder or you have a spouse or a child with an auditory processing disorder, you make up a big part of the team. You need to educate yourself on auditory processing disorders in terms of what is available to treat it, and what makes sense for your type of auditory processing disorder. So there are several programs out there that say they will treat auditory processing and they will cure it. You need to be careful about that. You really do need to educate yourself on what the program is, how it can help, especially for your type of auditory processing disorder. Because as you know, not all people respond or have the same type of challenges. You may also find that you need more than one program. So let's say you have a child that has an auditory processing disorder and you have discovered this at age 8. He or she may need one program now, but in a few years may need to use a different program to help because the issues will change. You'll also find that various people or professionals can help you with these programs. Some require that you go into an office and do several visits per week or several visits over time. Other programs can be done more in the home, and various people or various therapists can help you implement those. If you have a speech therapist who's versed in auditory processing, often they can help. It could be an occupational therapist, it could be a reading specialist, it could be an audiologist, or even a psychologist. Again, it depends on who you're working with and your team and your unique needs. So now I'm going to talk about a few people that I've worked with over the years with auditory processing disorders. The first person, Annie, came to me when she was about 3.5 years of age. Mom's biggest complaints were Annie's speech intelligibility and her behavior. Annie had meltdowns throughout every single day. People really had a hard time understanding her speech. She would talk in phrases and even short sentences, but people understood less than 10% of what she said. Her mother understood a little bit more, but still it was well under half of what Annie said. Annie had to repeat herself, and she would get frustrated and have meltdowns. She'd also get in trouble because she didn't follow instructions, and that caused a lot of stress in the family. Annie came to see me when she was 3.5 years of age. Her mother had scheduled a speech evaluation. Her biggest complaints were Annie's speech intelligibility and her behavior. It became clear during the evaluation that Annie was really struggling to understand verbal-only information. If we gave her some visual to support what was being said, she did much better. So we switched gears. We made sure that we got a good hearing test on Annie, that her hearing was within normal, and then we went ahead and did the auditory processing testing. The evaluation showed us clearly that Annie had an auditory processing disorder. So from a treatment standpoint for Annie, we fit her with an assisted listening device. It was a little device that went over her ear so she could hear speech more clearly. Once Annie was fit with her assistive listening device, she continued her speech therapy program. She progressed at a much faster rate and within a year had normal speech and language skills. What was interesting with Annie was within an hour of her having the assisted listening device placed, she was stating, "Annie, hear self." So she was recognizing that she could hear herself. She also changed behavior dramatically. Her behavior came much more like a typical 3.5-year-old. Now we're going to meet Joe. I met Joe when he was in 4th grade. He was a very bright boy. He had mild speech delays and was really struggling with listening, following directions, and reading. Due to Joe's auditory processing disorder profile, we decided it was a good idea to fit him with an assistive listening device as well. So we fit him with that. He continued working with his reading tutor, continued working with the school program, and he continued to progress and showed reading progression at a much faster rate as well. For Joe, he continued wearing his assistive listening device for a couple of years. After that, Joe felt he was doing extremely well, and we worked to start weaning the assistive listening device off. By the time Joe was a senior in high school, he was graduating with honors. He used his assistive listening device in one class, Latin. All other classes he was navigating well. He was reading at a high school or college level, and he was planning on going on to college. And now let's talk about Sam. Sam came to me when he was 16 years of age. He was in a residential program. Sam had been diagnosed with auditory processing disorder, autism, depression, and anxiety. Sam's biggest complaints were listening comprehension, sensitivity to noise, and his reading comprehension. We decided, based on his profile, that we were also going to try an assisted listening device for Sam. He tried it, and he used it for about 1 month, but it really did not work for Sam. We discontinued the use of the device. Sam was very bright and really embraced the idea of learning about auditory processing disorder. He wanted to learn about his type of auditory processing disorder, the strategies that could be used, and other programs. Sam continued on using a music-based program that was designed to help with the processing of sound. He did that for about 6 months, and then he also learned a lot of strategies. He learned how to advocate for himself. Sam is now in college, and he's using strategies that make him successful in college. So there you've gotten a couple of examples about people with auditory processing disorder and what they did in order to get successful treatment. Everybody progressed, but it wasn't the same program for everyone. So there's not one program that will work for every single person with auditory processing disorders. You want to work with your team to find out the best plan for your auditory processing disorder and follow through with that plan.